The scenes emerging from Chinese cities paint a heartbreaking picture. A long line of hearses in the northern port city of Tianjin, bodies awaiting cremation in Shandong province, an evening line of people at a funeral home in Shanghai. After meticulously tracking every case for 3 years, China's government has given up. There's no way to know how many people are infected or how many are dying. Government death figures of just a handful a day are outrageously low, but officials are defending them.
We count deaths from respiratory failure for those who've tested positive to COVID as COVID-related deaths. If the deaths are confirmed to be caused by underlying diseases, they won't be included in the COVID death toll. We've been open and transparent.
Officials say they're monitoring for new variants, but doubts about transparency are growing abroad.
The worry is that in a population in China with a sudden lessening of restrictions, who are much less vaccinated than Australia and much of the rest of the world, and who, when vaccinated, have been vaccinated with a vaccine that is known to be slightly less effective to current variants, that it could be a melting pot of huge numbers of infection with the possibility of a new variant arising without any real monitoring of that.
South Korea, Japan, Taiwan, the US and Italy are now implementing COVID tests for arrivals from China. But some other European countries have warned that could hurt the return of Chinese tourists, a sentiment echoed by Australia's tourism sector.
COVID response measures need to be science-based and proportionate and treat people of all countries equally.
Beijing, though, is still insisting people do a PCR test before flying to China, despite an outbreak that is well and truly out of control. Bill Birtles, ABC News.